I was trained as a haematologist 35 years ago. I differentiated entirely into the field of thrombosis. I came to McMaster in end of 1969, early 70, to establish a thrombosis program. His idea of this wave motion was a great one for various aspects of prevention and treatment of thrombosis. After discussions with him, he informed me that it would be possible to develop a device which was battery operated, which allowed people to wear it after they were discharged from hospital. And this was, at that time, I think, and still is now, quite an innovation, because one of the problems with preventing venous thrombosis is that the process of prevention needs to be continued well after the patient's discharged from hospital. We then followed that up with a study in the prevention of venous thrombosis in a group of patients in whom anticoagulants are potentially dangerous, yet thrombosis is a real problem. And these are patients who undergo neurosurgical procedures where even a small bleed post-operatively could be quite catastrophic. It was highly successful. We got about a 70% reduction, which is really very good. I think it was a little over 70% reduction in venous thrombosis using a device. The patients took the device home and they wore it for a period of 2 to 3 weeks. That's also been published. So we said, so there seem to be two obvious indications. One, the treatment of patients with the post-thrombotic syndrome, and two, used for the prevention of venous thrombosis when anticoagulants, which are the standard form of treatment to prevent venous thrombosis, when anticoagulants are considered to be dangerous to use. The Venowave has the potential to help anyone whose symptoms are caused by sluggish blood flow in the veins of the leg. So these are people with who are at risk of venous thrombosis because they've had an operation, or risk of venous thrombosis because they're lying in bed or paralyzed. People who have had venous thrombosis and who have raised venous pressure as a result of the venous thrombosis. People who have swollen legs associated with aching and pain on standing due to defective valve function, because about 50% of such people do not have previous venous thrombosis, they just have defective valve function.
The Venowave is an effective drug-free therapeutic solution. It can be used in hospital and at home. It offers greater effect than compression stockings alone, has good patient compliance unlike pneumatic compression devices, and is cost-effective.